my point today was to talk a little bit about brain development and what we know and how that may actually inform how we approach patients, not just in eating disorders, but I think in mental illness in general, maybe in education too, maybe in child rearing too. And I think that there is good data to say, this can inform us. A conversation about the brain just a few years ago looked more like this, right? Certain areas of the brain do certain things, and it's divided in lobes. Today, we should be thinking more about this highly interconnected set of neurons, of cells, that is quite a complex but also magnificent, I think, testament to humanity, if you will. And more data emerging as to how complex but yet well-planned this is. So very recent data in mice, for example, talk about the fact that even though if we actually sort of straightened out all of the sort of the wiring in our brain, it would probably go around the earth, right? The methodology to putting this together is immense, because what we're learning is that, for example, it's very likely that any one neuron only connects with another one neuron, right? And each of these sort of wires cross each other at about 90-degree angles. And it's sort of amazing to think about how this has evolved. And that's probably true from worms, at least that we know of, all the way up to mice, very likely to also apply to humans. Now, kids' brains are different, right? My kids don't like this slide. they don't appreciate this one. But it's a fact. And I think that the question, one of the dogmas of pediatrics is that kids are not just small adults, right? They have their own biology, their own physiology, their own developmental challenges and the like. And I think it's important to think about how we can put that better understanding to good use, if you will. Now, I think most of us know what the brain is made up of, but the clear important message here is that gray matter is composed of neuronal cells themselves, right? And the offshoots that they put forth. And then white matter actually is constituted by the myelin that coats that immense sort of mesh of interconnections of dendrites and axons that connect one cell to the other. Of importance is that the building block of myelin is cholesterol, right? And of course, if we think about that a little further, the building block of estrogen is also cholesterol. So we need to be thoughtful about that, if you will. So hopefully, we can get through this a bit and talk about brain development, both in childhood and adolescence, with some special sort of look at this notion of proliferation and pruning, sequential maturation of different areas of the brain, and how hormones influence brain development. And hopefully we can get to how we apply this, or we can apply this, when we interface with young people, and really in any realm, clinical realms, educational realms, and the like. It turns out that the human brain has two major growth phases in our lifetime. The first of which, in childhood, starts in childhood, of course, in utero. And both of these major growth phases occur at the expense of two processes. One is called proliferation, right? Or multiplication, if you will, of size. It can happen at the expense of multiplication of neurons, meaning that one neuron divides and then we have two, and those two divide and we have four, and so on. The brain can also proliferate at the expense of, while maintaining a relatively stable number of neurons, those neurons can actually shoot off more dendrites and axons, meaning more interconnections. And that also thickens the amount of gray matter available of what constitutes brain cells themselves. So that process is important. It tends to be followed by a process of pruning in which networks, either connections or neurons that are not readily used, then can be trimmed back by the system, right? And that's done through a process called apoptosis, or designated cell death. We're all engaging in apoptosis as we speak. We're killing skin cells, for example, okay? So really important to think about how biology sort of shapes itself in many ways, and bone is a good example. We're always making bone and destroying bone at the same time. So the first phase happens in a relatively short period of time, the first phase of growth, via proliferation and pruning, and it happens in utero. So the first 6 months in utero is a highly proliferative phase in brain growth. You can imagine, right, the brain from conception to 6 months. 6-month-old babies have relatively fully formed brains, at least in the sense of how we look at the morphology of the brain. So it's a little brain, but it's a fully formed brain, if you will. And then in the last trimester, pruning dominates the scene, and the brain of babies in uteros actually trim back to really ready themselves for birth. So a newborn baby, a newborn term baby, is really a survival machine, right? That brain is really tuned into, I need to make it. So if you think about what babies do, right? They smell, they grab on, they suck, they swallow, and so on. That's really what it's about. So it's a very good example of the brain saying, I really try to master what I need. And it's a good example of that. So that phase concludes in about 9 months. And then if we survive birth, most of the time is when we survive birth, but that's not true for everybody, not everywhere. Then we go into a second long phase of brain development, of brain growth, if you will, in which in the first 6 years of life, it tends to happen at the expense of proliferation of gray matter. So there is tremendous, those are years of tremendous brain growth. As a matter of fact, by about age 6, our brains are almost the size that they're going to be now as we get to adulthood. So clearly the size is attained via proliferation of and essentially making a significant number of cells, interconnections as well. Then from age 6 to age 12, or thereabouts, that proliferative phase continues. We don't take to make as many neurons as we do in the first 6 years of life, but the neurons that we do own tend to put out lots of axons and dendrites, so lots of connectivity between cells. It's really an enhancement of the communication capability of the brain, if you will, and that tends to peak when we reach puberty. So a little earlier, 11-ish for girls, 12-ish for boys, and as puberty comes into the scene, that usually marks sort of the completion of that long, about 12-year proliferative phase of brain growth. This is important. This is important because I think we need to think of, right, we can understand that insults in utero can have long-lasting effects, impact the brain in very significant ways. Insults in early life can also have very significant impact on the brain, both in the short term and sometimes potentially in the long term as well. So as adolescent enters the scene, the brain is mostly done a good bit of its growing, and it tends to shift towards then a long phase of pruning or trimming back, trying to sort of become highly specialized, if you will. So that shift is an important shift that tends to coincide with sex steroids or estrogen, testosterone hormones sort of entering the scene, if you will. And that shift is important. So it's important to the tune that, for example, in this time-lapse photography, the bluer, the less number of neurons, right? The redder, the picture, the greater number of neurons, so that you can see that from age 5 or so, right, we begin this process of gradual trimming back, and a lot of that happens in the adolescent years. So the brain of a 20-year-old has a lot less brain cells than the brain of a 5-year-old. Because here the size was attained, and here it is sort of fine-tuned. Now the cells that remain do have fairly enhanced functioning, if you will, or functional interconnectivity. That process is significant during adolescence to the tune of losing nearly 1% of neurons per year, or almost about 15% of our brain cells are sort of pruned back during that phase of long pruning during adolescence. Now, it doesn't happen, you know, there is a method to the madness. And the method to the madness seems to be this concept of neural Darwinism, in which networks or interconnections that are highly used prevail and get further enhanced, and those that are not sort of tend to trim back. So Karen had, you know, tennis in her, and she practiced tennis, right, as she clearly told us, and she became very good at tennis. She probably could have been a cellist as well. She just didn't practice the cello. So, so she probably trimmed back those cello neurons at some point in her life. Now, as this occurs, then that white matter is really thickening. So that cholesterol-based myelin sort of coats and coats and coats the remaining wiring, because that is really what enhances the effectiveness of, you know, energy traveling through that wiring. Another important time in which clearly nutrition plays a very significant role. And nutrition, I think, in the way that we need to understand it as sort of a process that meets all our needs, you know, comprehensively, not nutrition. So healthy eating sort of, in my mind, takes a very different dimension when you're saying, okay, I'm feeding the brain that is really sort of enhancing itself as this turns out. So this coating or myelinating effect actually enhances processing speed. And raw processing speeds tend to increase pretty steadily until about age 25 or so. So if you want to play video games well, start early. Don't wait till now. And overall, this whole process seems to sort of perhaps continue until about the 5th decade of life or so, if you will. So that's one aspect of proliferation and pruning. As this is happening, there are different areas of the brain that seem to mature sequentially. Now, the important distinction for me, and I think to communicate to families as we discuss this, is that this doesn't mean that young kids don't have all of these areas of the brain happening. And you're signing your, I don't know, your wedding certificate. You usually don't go on with the left hand. You stick with your right hand, with your dominant hand, because you lead with your best pony, if you will. And the way this tends to occur is actually from the back of the brain to the front of the brain. And that has profound implications, especially during mid-adolescence, as to what this really means. So in the back of the brain, we begin with full maturation of the cerebellum. And of interest is that cerebellar function, true, very important in positioning and sort of reading Mother Earth, right? But also very important in higher functions like mathematics and even reading of social cues. So all of you, well, mostly me right now, I'm looking at you sort of using my cerebellum and saying, okay, who's bored? Am I doing a good job? You know, how is this working out? Next is the amygdala, and the amygdala tends to be the emotional center of the brain. And many species, you know, many lower species develop a brain stem, and sort of their CEO, it's sort of a small CEO limited to the amygdala, right? So being amygdalar predominant means that you are a reactive, right, fight, flight, or freeze sort of being, entity, if you will. And if you remain that way, that's the way you sort of tend to function going forward. Next are the basal ganglia that tend to actually have very important function in organizing information, right? So information comes in through the back of the brain. We can be reactive next, and then if we're not reactive, then we have the opportunity to organize the information. The corpus callosum shares information between the two halves of the brain. And then finally, sort of the CEO comes online and executive function really sort of matures, right? And that's the prefrontal cortex, if you will. So very interesting that in diffusion tensor imaging studies, we can see, for example, that the basal ganglia, the secretary and the CEO tend to work together very tightly, lots of fibers, because if the information is organized, the point is to present it to somebody, right? You don't want to just organize it to have it organized. You want to organize it functionally, if you will. So important sequence of events that in summary, I think says, you know, our brains tend to proliferate from birth to about 12 years of age, right? Then we go into this long phase to probably the mid-20s of pruning and enhancing of function that is really used and that remains. And then lastly, we have the prefrontal cortex fully coming online, and we sort of develop the capacity for higher function or executive function, if you will. So I think the important message here is that brain maturation is probably complete for most humans by about age 25 if there has been no detour. And what we tend to run into in the populations that we're talking about, so kids that get into, drugs and alcohol and, doing their stuff, or kids that get into eating disorders and malnutrition or nutritional chaos, I think what that really poses is a detour from normal development. And that detour can last and have an impact for years. So good news, bad news, right? I think the translation of this for families is, look, if you have a 25-year-old who got ill when she was 15, 10 years of anorexia nervosa, right? Oh my gosh, this is chronic. Well, no, because the reality is that in that detour, this is an individual that this brain may be coming into their best odds for recovery, maybe hitting 28 or 29, right? Really important, really important. I think it's one of the things that we should think about as we think about don't give up on patients. The reality is that, this is a very different scenario than somebody who's now 45 and has been at it for 30 years, right? That's a different message there, if you will. But I think especially with, early onset of eating disorder symptomatology, we need to be careful with the sense of when we say this has been going on for a long time and therefore, the odds change. Why is that important? Well, you run into 28, 29-year-old patients that say, well, I should go into a harm reduction model, right? And I should weigh better than I used to, but not enough to sort of be okay. That's sort of, in a nutshell, a harm reduction model, and I don't think that at those ages we should be contemplating that just yet. So let me shift again to hormonal influences, and this is important because, again, cholesterol is the building block of both estrogen and testosterone. And we know that sex hormones, sex steroids, both from the gonad, ovary, and testicle, and of adrenal origin, are extremely active in the brain and have well-represented receptors, and that's really important to sort of think about, right? It's not a coincidence that estrogen receptors are quite present in the brain, and testosterone receptors are quite present in the brain. I think it says a lot. This particular study looked at an aspect that I took out for time's sake, which is brain mapping, right? So we know, for example, that the representation of estrogen receptors is greater in the amygdala than anywhere else in the female brain, right? Very different from the brain mapping or distribution of testosterone receptors for men, right? So important to think about sort of the biology of the differences, if you will. This is another aspect of this that says that the presence of estrogen is actually a growth factor for brain cells, right? It actually enhances brain cell growth. So this is a hippocampal neuron grown for 48 hours without estrogen, and this is the sister neuron grown for 48 hours in the presence of estrogen. This one is growing much more readily than this one in the absence of estrogen. So as a young girl starves herself, right, or a young man starves himself, and they knock off their sex steroid production, one of the important aspects of that, one of the downstream consequences of that is that they may also be unintentionally impacting very important aspects of brain development, including neuronal growth. So an important question comes often from families, right? We can document brain atrophy, like we can document demineralization of bone and the like. And the question is, will my child's brain grow back? And this is important. This is important because the answer is complicated. I think the answer is yes, your child's brain can grow back, but it may take more than meets the eye. So I'll summarize the data just for the sake of time for you. And it's essentially three messages in this data, right? If you stay underweight, your brain size does not recover. So you have to really normalize your weight in order for your brain size to recover. Second, if you do normalize your weight, it may take about a year of normal weight before you actually attain normal brain volumes again. So for the brain to look normal again, you may have to stay at weight for a year. And three, it's important that even normalization of brain size does not equal normalization of brain function. So it is becoming very clear that individuals that maintain, for example, menstrual irregularity, right? And these studies have been done in females, obviously not in males, but it's just a marker, essentially may retain abnormal neurocognitive function even if they have attained normal brain size again. Because I think the real issue here is that, you know, as Catherine was mentioning earlier, we're talking about a complex machinery in which weight is one marker, right, of proximity to wellness, but not a determinant of wellness. So we don't hit a normal weight and then everything is hunky-dory. That's not the way the system is made. So the challenge becomes that really the current data suggest a complex interplay between weight status, normalization of stress responses, i.e. cortisol. Cortisol is not just bad for bone, it's also bad for brain, for example. And global hormonal well-being for optimal brain function and ongoing brain maturation, right? So weight, one important marker. Should we continue to follow it? I absolutely think so. But at the same time, we have to sort of say, okay, it's a proxy. It's not the end-all be-all. So weight recovery alone may be insufficient, and really recovery from a nutritional status may require reestablishment of overall wellness. So things like adequate body composition and reestablishing normal hormonal function to actually support optimal brain functions. I think the message is, right, it's about having an all systems go neuroendocrine environment, not about just simply weight recovery. And the time frames become quite important in this sense. I love this cover of Time, right? Really important. I think we need to sort of revisit the idea of, you know, what is healthy eating and what is unhealthy eating, because as a culture, you know, I think we're pretty skewed from that perspective, and sometimes with the best of intentions. So how does this apply to the treatment of eating disorders, or really to working clinically or educationally with just about, you know, all kids during this phase? Well, first of all, I think we need to both consider willingness and we need to consider ability, right? This is an important yin-yang. You know, it's unfair to ask of an individual what they are no longer developmentally appropriate to deliver, right? It's almost like saying to somebody with Alzheimer's, I just want you to remember, right? That doesn't work that way, because that really questions, you know, what we're saying is, look, your willingness should trump your ability. And the reality is that in development, it's sort of the other way around. Ability tends to set the tone. On the other hand, I think it's important to elevate the expectation in the sense that willingness becomes important. And there are very good studies that say that neuronal development, as we engage in proliferation and pruning, right, is driven by biological wellness, but also facilitated by the expectation of elevating your function, your performance, your level of play, if you will. So if you got a good forehand and you just stick to having a good forehand, that's your game. If you work on then developing a good backhand, then you complete your tennis game. Karen, I'm doing my best to relate here to you. I mean, you know. So clinical considerations in teens, concreteness is a very important factor, right? It can really, the differences in communication style between concrete individuals and individuals who sort of develop more abstract thinking is quite significant. About 15 to 20% of the US adult population remains quite concrete in their thinking style. And it's really, really important to think about that, right? So, boy, they didn't hear what I said may mean they didn't hear what I said, or I'm pitching it in a way that is, you know, not quite congruent with their communication style, and that becomes quite important. Alexithymia is a very important topic, I think, not just in eating disorders, but in, you know, sort of working with kids in general. And alexithymia is the inability to put words to feelings, right? We were all profoundly alexithymic at one point, remember? Right? Hopefully we're not anymore. But you know, I learned important things today. I thought that Slipknot was something that was used in, you know, fly fishing. And I thought that Reds was these guys that played baseball in Cincinnati. And now, see, I was a little alexithymate this morning, and now I'm better just for being here. So concrete individuals that have difficulty expressing themselves sort of tend to physically act out, right? 2-year-olds are the prototypical example of this, right? So the important thing in managing a temper tantrum, for example, right, is not to extinguish the temper tantrum, but to actually help them establish some different way of communicating what it is that they're feeling and struggling with. So at the end of the day, we need to be mindful that that remains the case, right, as kids grow up. So kids that are acting out in a myriad of ways, one side of us has to say, where is risk and how do we manage risk? And the other side of us has to say, what are they telling us? So as they cut, as they act out, as they restrict, as they binge, as they purge, I think we need to have an ear to the ground to develop a better understanding of that. Important to think that especially for early teens, or teens who in some way have delayed their brain development, limited social cognition, especially in large groups, becomes quite important, right? Important message for us in treatment. We get these alexithyming kids and tell us, say to them, tell us how you feel. And then we sit them in a large group and say, okay, let's process your emotions, right? Important to really think about that and then how to tailor these experiences. Set shifting difficulties have been clearly established, especially in anorexia nervosa, right? The inability to move from one set of circumstances to the other, right? Really important as we have, a pretty intense family session. We end at 5:55 and then dinner is at 6, right? Not conducive. And we can take that to the classroom. We can take that to, anything of that sort in which set shifting comes into question. Weak central cohesion has been another important aspect of biological brain function that has been established in anorexia nervosa, and it's the inability to see the big picture, sort of getting stuck on the details, and you can see how important that is when it comes to, for example, at Eating Recovery Center, as we have really launched to adapt ACT to younger kids, we have to take that into account. We got to be careful that we don't ask them to see a big picture that they're not quite capable. Their cognitive scope is not quite there yet, if you will. At the end, what we tend to be dealing with quite often in the classroom, in the counseling office, or in a treatment center is a significant, frequent sense of dysphoria. And we tend to approach dysphoria as to why. And dysphoria doesn't have to have a why. Dysphoria can be just cause, right? Really important to sort of think about that, if you will. What dysphoria can translate into is emotion regulation. Dina did a great job talking about that today. And of course, what the key ingredient seems to be sort of founded in us assisting our patients or the young people we work with in developing a greater sense of distress tolerance. That's really where it's at. So when we think about treatment modalities, right, if we think about CBT, DBT, ACT, usually in adults, insight-oriented sort of behavioral change models that tend to regulate emotion, assist in regulating emotions, or if we think about FPT or even cognitive remedial therapy in more either chronologically, emotionally younger, adults, if you will. At the end of the day, what we're really saying is, look, we have to adapt these modalities to match sort of the stage of brain development so that we are not asking you to step beyond your developmental capacities and at the same time continue to have that, continue to set that expectation of maturation and personal improvement and growth, if you will, because we also want to facilitate enhancing brain function and capacity overall. So at the end of the day, as we treat patients with eating disorders, two things become important in my mind, based on what we know about neurobiology today. One is that full nutritional rehabilitation, so both the quantity, i.e. intake, no relative deficiencies and the like. I mean, that's just not in female athlete triad, right? The relativity of nutritional deficiencies can happen in almost any context for any human, and qualitative nutritional rehabilitation is important to reestablish, and this seems to be really necessary to give young brains sort of the ability to return from an eating disorder and play developmental catch-up. I think the other important message is that weight recovery and full interruption of purging, exercise, and other eating disorder-related behaviors needs to be an essential component of any treatment effort, right? So, you know, whether a treatment effort is focused on DBT or ACT, right? That's a debate that we can have, right? But I think the debate that we should not be having is that as that happens, then nutritional weight recovery when necessary and full interruption of any other behaviors really becomes necessary, because at the end of the day, what we're trying to accomplish with this, as we refeed an individual or as we treat an individual, as we sort of, you know, point them towards recovery, it is to de-stress the brain. And what happens with these behaviors is that, you know, as we've been discussing, you know, all along today, is that they're short-term solutions that actually bring downstream ripple effects that can be quite toxic to the brain. So the idea of de-stressing the brain it may actually facilitate the concept of recovery.